Hello, I am Andrew Jones, and this is a short video for the new operations manager in our healthcare system. I will explain key theories, their relevance in the organization today, and how they can be used to improve the performance of the company. Operations management is usually thought of in terms of production and manufacturing of consumable goods and products. People tend to think of operations management in terms of improvements to the production process, the supply system, or the control of the quality and defects of the products. While these are all partly correct, they miss the point that the larger idea is that operations management is an approach to any system or collection of systems that focuses on improving the outcomes or efficiency of the systems by making them more efficient and making the systems utilize resources. However, we must remember that operations management can also be applied to service industries, not just manufacturing or goods industries. The fact that some operations require the combining of oversight of goods as well as services is particularly appropriate to the hospital setting. While the trend is often to assume that the newest research and newest proposals are going to be the best and should be adopted, that is not always the case. In the healthcare setting, it is advantageous that the delivery of healthcare has moved to renal and peritoneal dialysis instead of applying leeches to drain the bad tumors. However, one of the theories of operations management that can be best used in a diverse and complicated setting is going to be Henry Fayol's application of the management function, because healthcare systems are very diverse and very complicated. The 5 functions of management, as defined by Henry Fayol, are planning, organizing, command, coordination, and control. In 1916, Fayol published his seminal work where he identified 5 core functions of management. If these functions were focused on and integrated, he contended, then the systems will become more efficient and there will be a significant reduction in waste. The organizations that use this system approach could also realize a higher per unit yield on the resources, which would translate into better profits and operating efficiency. One of the critical factors of production and service delivery that Fayol focused on was the staff or the employees. By using the 5 functions of management that Fayol identified, the hospital can address several of the larger problems with its operations that it will experience. One of the common criticisms of American healthcare is how expensive it is to receive healthcare in the United States. A hospital is in a precarious position of having to address high costs while receiving low reimbursement rates and trying to make sure that certain deadlines in terms of quality of the healthcare delivered are not passed. Cost and staffing are 2 of the most problematic issues for hospitals. They often run low on supplies, and these supplies are costly and also have expiration dates. The issue with staffing is also a national problem, with not enough nurses and not enough nurses being trained every year. To address these problems, the hospital administrator or operations manager can use Fayol's system. They can address supply issues by analyzing supply trends in the past and expected supply needs in the future, and ordering on a just-in-time or minimal overhead system. This would address costs of resource issues. They can also adopt a scientific staffing system. Since they have shortages of nurses to fill the open positions, the patient care level can suffer. By using modern scientific staffing and analytic tools to predict the staffing needs and shortages, the resource shortage for the whole enterprise can be lessened by moving nurses around where needed to be scheduled when they are needed the most. The conclusion and recommendations for the hospital will be to review Fayol's system and writings and to apply the pertinent ideas wherever and whenever possible. The staffing issue needs to be addressed, and this is largely a matter of planning and controlling resources. The hospital administrator would also do well to remember that 2 of the important principles of management that Fayol articulated were subordination of interests and remuneration. If these are applied, the hospital will achieve better outcomes and be more efficient.